My name is Lilla Ungwary. I'm an ophthalmologist. I live in Hungary. I've been working in a clinic first when I started my career as an ophthalmologist, and we did there several very serious operations, laser treatments, and I saw several people getting blind, and it was very, very upset. I thought that it is not the right time when we can do anything for the vision of people. I started thinking about what can we do when the problems start. So first I went to study Chinese medicine because I thought that it's good to manage somehow the energies. Later, I became a very special doctor. I'm an aeromedical doctor as well. It means that I examine pilots if they are fit to fly or not. At that time, it was very interesting to meet the other aspect of the eyes and the vision. It means that as an aeromedical doctor, I didn't treat very serious eye diseases. Rather, I examine the vision. But vision means sometimes not only the visual acuity, but also the interest, the attention, and other things. And it was very interesting that pilots were telling me stories about their vision improvements, and that they did something to get better vision. It was quite new for me because earlier I saw some people who had better vision, but they didn't do anything for it. It just happened. For example, a small myope became normal or something like this. But among the pilots, it was usual that they did something. And at that time, I started to see worse for near. So I was thinking, it's interesting that pilot can do something for the better vision. What can I do for my vision? Because when I put on the reading glasses first time, it was better to read, but it was very bad feeling for my eyes and also for my brain. And when I took off the eyeglasses, I was really surprised that I couldn't see what I saw before. So it was a shock for me because earlier my eyes were good. So I went to find somebody who can help me, who can teach me. At that time, there was only one man in Hungary who knew Bates method. His name was Peter Vén. So I went to him, and he told me several things about Bates method. He invited me to his lectures, to his private hours. I could see him, how he's working. And it was very, very interesting. Later, I went to the Holistic Vision Conference to Italy, and it was a big change in my life because I saw many, many interesting people. They were very friendly, they were very open, they were very happy. And I decided, I want to do this because I like this field, I'm interested in these things. So I started dealing with people like this. And the journey just began with this decision because there are several methods, but there are several people, and each person is different. And I realized that I should find the key for each person. In the meantime, I study very useful tools, because I see that the vision connected with several other things. For example, with our feelings, with our mind, with our muscles, with our posture, with our breath. So I studied, for example, somatodrama, which is quite similar to family therapy, but we are connected with our organs in this place. Then I found a very, very holistic method. This is D-Smile, which I like very much. This D-Smile was put together by a friend of mine. She is a speech therapist. And she also found that it's not enough to deal with the tongue or the mouth. She had to work with the whole body. So she put together a very, very effective method, which uses the orofacial muscles, which uses the tongue, and this affects the whole body. We use our voice, we use our muscles, we deal with our fascias, and all it affects also for the breath, which is very important. And what we found that the awakening of these muscles and the good position and the good work of the tongue is very important for the balance, for the power of the body, for the good posture, and it awakens also the eye muscles and the whole face. So this D-Smile is a very effective method. And what I also like, because I'm a doctor and I like to measure the effect, that we have an input and we measure the patients with a very interesting sign method, and we have an output, and we can compare the two pictures and we can see the result. And that's why I like this D-Smile very much, and I hope that I can show this many vision trainers and they can use it in their therapies.